Hello everybody and welcome to Species Specifics. Today we're going to be discussing pet birds. If you are new to this series, the goal of these lectures is to cover unique diseases of different veterinary species that are specifically mentioned in the ICVA NAVLE study guide. I've also included some diseases that were not specifically mentioned but may still come up. The focus of these lectures is on disease recognition through images, clinical signs, and diagnostic tests. I've also highlighted key, easily recognizable characteristics in bold. For our birds, we're going to start by looking at two bacterial diseases. Psittacosis is a bacterial infection caused by Chlamydia psittaci. It is most common in cockatiels, budgies, and small parrots. This is a zoonotic pathogen that can cause flu-like illness in people. Clinical signs in birds include ocular and nasal discharge, dyspnea, diarrhea, and biliverdinuria, which is yellow-green droppings. The main treatment available is doxycycline. Mycobacteriosis is most commonly caused by Mycobacterium avium in our bird species. It typically affects older birds due to the chronicity of infection that is required. This infection also is potentially zoonotic. Clinical signs include weight loss, diarrhea, and depression. Treatment requires long-term antimicrobial therapy. Next, we will look at some fungal diseases. Aspergillosis primarily affects immunocompromised birds, and parrots and cockatiels appear to be predisposed. Risk factors for developing this infection include poor hygiene and poor ventilation. Clinical signs include anorexia, dyspnea, and nasal discharge, and it is treated with antifungal medications. Candidiasis is most common in young or immunocompromised birds. Risk factors for development include antimicrobial use, poor husbandry, and unclean environments. Clinical signs include weight loss, white plaques in the oral cavity, and regurgitation. Treatment focuses on optimizing husbandry and the use of antifungals. The avian gastric yeast is Macrorhabdis ornithogaster. This condition primarily affects smaller companion birds. Clinical signs include regurgitation, weight loss, passage of undigested food, and diarrhea. It can closely resemble proventricular dilatation disease, which we will discuss later. The treatment for this condition is antifungal medications. Now we will look at several viral diseases. Psittacine beak and feather disease is caused by psittacine cercovirus. This condition primarily affects young parrots and is transmitted by inhalation or ingestion. Clinical signs include abnormal feathers, beak lesions, and weight loss. Treatment typically focuses on supportive care, but these cases typically have a poor prognosis and often result in euthanasia. Proventricular dilatation disease is caused by avian bornavirus. It primarily affects macaws, conures, and African gray parrots. Clinical signs include chronic weight loss, passage of whole seeds in the droppings, and regurgitation. Treatment focuses on supportive care, reducing stress, and NSAID therapy. Avian poxvirus has three forms. The cutaneous form affects the face, beak, and legs. The diphtheritic form affects the oral mucosa. Finally, the septicemic form affects the respiratory system and the GI tract. This virus is spread by biting insects such as mosquitoes. Treatment focuses on supportive care. Polyomavirus causes two conditions, Budrogar fledgling disease and non-Budrogar polyoma infection. Clinical signs include crop stasis, feather dystrophy, hemorrhages, and sudden death. Prevention focuses on strict nursery hygiene and vaccination. You should also avoid housing budgies with other bird species due to this disease. Newcastle disease is a viral infection that is most common in poultry, but can also affect pet birds. In our pet birds, the viscerotropic velogenic form of Newcastle disease is the primary concern. This disease is reportable in many jurisdictions. Clinical signs include weight loss, bright yellow-green diarrhea, and neurologic signs. Treatment is primarily supportive care, but often jurisdictions require affected birds with this disease to be culled. Pacheco disease is caused by cytosine herpes virus. This viral infection results in either hepatitis or internal papillomatosis in birds that ended up surviving hepatitis. Clinical signs include yellow-green droppings, diarrhea, and regurgitation. Treatment involves supportive care, and prevention centers around vaccination. Finally, we have West Nile virus. This is a flavivirus transmitted by mosquitoes. Infections are most common in young birds and cause symptoms like weight loss, ataxia, head tremors, seizures, and death. Treatment focuses on supportive care, while prevention centers around controlling mosquito exposure. Next up, we have some parasitic diseases. Air sac mites are primarily the species Sterostoma tracheocolum. This infection affects canaries and Gouldian finches. Clinical signs include dyspnea, sneezing, and open-mouth breathing. Treatments include ivermectin or moxidectin. The scaly leg mite is Nematocoptes pilae. It is most common in budgies. Although it has the name leg mite, it often affects the face as well as the legs. The main clinical sign is white proliferative crusting on the beak, legs, or vent. Treatments include ivermectin and moxidectin. Feather mites are fairly uncommon in cytosine species, but when they occur, they are primarily Dermanisis gallinae. Most birds are asymptomatic, but you may see feather-picking behaviors. Treatments include pyrethrin sprays or ivermectin, as well as treating the bird's environment and nest boxes. Trichomoniasis is caused by Trichomonas gallinae and primarily affects budgies. Budgies acquire the parasite through ingestion. Clinical signs include dyspnea, weight loss, salivation, and regurgitation. The treatment of choice is metronidazole. Giardia infections are most common in cockatiels and are transmitted through ingestion. Clinical signs include feather pulling in the inner thigh and axillary regions, and a popcorn appearance to the droppings. Treatment usually involves metronidazole. Sarcocystosis is a major cause of mortality in outdoor housed parrots. Parrots acquire the pathogen through interactions with infected opossum feces. This condition can affect the lungs, muscle, or central nervous system in parrots. Clinical signs include respiratory distress, ataxia, anemia, and weakness. Treatments include trimethoprim sulfa and pyrimethamine. Next up, we have reproductive disorders. Cloacal prolapse is a condition that can occur in any bird that is straining frequently. It is most common in egg-bound hens and adult male cockatoos that have a close attachment to their owner. Treatment involves cleaning the exposed tissue and replacing it, then enacting handling changes to help prevent recurrence. Persistent egg laying is most common in small birds, especially cockatiels. Risk factors for this condition include high-calorie diets, housing birds in the same cage, or having a strong bond to their owner. The main clinical sign is repeated clutches or laying more eggs than normal. Treatments can include decreasing the bird's day length, dietary adjustments, and hormonal treatments. Egg binding is most common in cockatiels, budgies, and lovebirds, and is usually associated with persistent egg laying or a calcium deficiency. Clinical signs include a distended abdomen, dyspnea, and depression. Treatments may include parenteral calcium, pain control, and oxytocin. In some cases, the egg may need to be removed through manual extraction. Coelomyces results from release of egg yolk into the abdomen, which causes bacterial infections. It is most commonly seen in cockatiels. Clinical signs include abdominal distension and ascites. Treatments may include abdominocentesis, supportive care, and antibiotics. Next up, we have several nutritional disorders. Goiter is most commonly seen in budgies that are consuming an all-seed diet. These diets are deficient in iodine, which results in goiter. Clinical signs include stridor and wheezing due to the pressure of the thyroid on the bird's syrinx. Treatment involves iodine supplementation and diet changes. Xanthomas are locally invasive fatty masses in the skin. They are most common in cockatiels and budgies, and may be related to dietary factors or inadequate vitamin A. Clinically, you will see these as masses on the wings or keel, and they are typically treated through surgical resection. Hypovitaminosis A results in squamous metaplasia of epithelial surfaces. This condition is primarily associated with feeding diets that are really high in seed content. Clinical signs result from the abnormal mucosal surfaces and include things like nasal discharge, sneezing, periorbital swelling, and dyspnea. Treatment involves supplementing vitamin A and adjusting the diet long term. Metabolic bone disease can also result from high seed diets, as these diets have a poor calcium to phosphorus ratio. The disorder can also result from inadequate UV light exposure. Clinical signs include ataxia, seizures, thin-shelled eggs, and bone abnormalities. Treatment focuses on calcium and vitamin D supplementation and dietary changes. Next, we have 3 common toxicoses. First up, we have Teflon. Teflon and other types of non-stick pots and pans release a gas when they are heated that is toxic to birds. This type of toxicosis is most common in birds that are housed in or near kitchens. Clinical signs include dyspnea, ataxia, and acute death. Treatment is primarily supportive care. However, this condition has a poor prognosis and typically results in euthanasia. Lead toxicoses can occur from ingestion of metals such as costume jewelry, bird toys, etc. These metals degrade in the ventriculus and release lead into the bloodstream. Clinical signs include regurgitation, diarrhea, PUPD, seizures, and hemoglobinuria. Treatment involves supportive care and chelation therapy. Zinc toxicosis can cause similar clinical findings, but results from the ingestion of galvanized toys, pennies, bells, keys, etc. Again, treatment involves supportive care and chelation therapy. Next, we have a mixed bag of non-infectious diseases that didn't fall under one of the other categories I've already talked about. Pododermatitis is inflammation of the feet and is most common in older birds. Risk factors include inappropriate perches, poor diet, obesity, or injury to the opposing leg. Clinically, you see proliferative or ulcerative lesions on the feet, as well as lameness. Treatment focuses on addressing husbandry, encouraging weight loss, and performing basic wound care like bandaging and antibiotics. Crop burn is a condition that results from feeding formula that is too hot to baby birds. The skin around the crop becomes red and inflamed, and you may see blistering or fistula formation in severe cases. Treatment involves antimicrobials, anti-inflammatories, and nutritional support, and many of these birds will require surgery once they have stabilized. Crop stasis, or sour crop, is most common in hand-fed chicks. Clinical signs include a distended crop and regurgitation. Treatment focuses on physically emptying the crop, as well as fluid therapy. To help prevent crop stasis, you should ensure that young chicks receive frequent, small meals. There are two main beak deformities in pet birds: mandibular prognathism and scissor beak. Mandibular prognathism is most common in cockatoos and can be treated by pulling the beak upward and outward several times a day. Scissor beak is the lateral deviation of either the upper or lower beak and can be treated by placing a counterforce on the beak several times a day. Splay leg refers to deformity of the legs in young birds. This condition may be associated with nutritional deficiencies or inappropriate enclosures. Treatments include placing hobbles or other supportive devices, and some birds may require surgical intervention. Renal tumors are most common in budgies and are particularly common in young to middle-aged males. They can cause unilateral or bilateral lameness, which is a fairly unique presentation of this type of tumor. This lameness results from nerve compression caused by the tumor, resulting in limb paresis. Treatments for these tumors can include chemotherapy and supportive care. Feather plucking in birds has many potential etiologies, ranging from parasites to malnutrition to stress. Once the behavior begins, it can become a stereotypy that persists even if the underlying problem is corrected. Diagnosing feather plucking requires a full evaluation, including blood work, viral testing, skin biopsies, and radiographs. Treatments may include diet changes, environmental enrichment, or psychotropic medications. Gout refers to the abnormal deposition of uric acid within the body. These deposits can either be visceral or articular. Usually, gout indicates that there is some underlying renal disease in birds. Clinical signs of gout include lameness, joint swelling, and acute death. Treatments may include fluid therapy, pain control, and dietary changes. Thank you for watching Species Specifics. If you enjoyed this video, remember to like, subscribe, and share with your classmates. If you're feeling generous, there's also a link in the description where you can buy me a coffee to help fuel future video making. Thanks again for watching, and we will see you in the next video.